Right.
Where I was actually a history political science major. So then when I decided to go to Bastyr for acupuncture school, I had to take a lot of chemistry prereqs. So kind of switched paths in life, mostly because I didn't like my desk job with data entry. I know you're shocked. I would work with people and have really good one-on-one interactions with them. So that's what kind of led me down the little road to acupuncture. So in order to practice acupuncture in Washington State, you need to have a master's, and that's a 3.5-year year-round program. So it's a really intensive program. And there's actually talk in the profession about changing it to a doctorate. So I think that'll be good for the profession. I hope they do that. And in order to practice, you also have to pass board exams. So the AOM, which is our national exam, has 4 tests. In order to practice in Washington State, you need to pass 2. I passed all 4 because
Because you're awesome.
That's right. So that's a little bit about me. So when you see an acupuncturist, we're very well-trained medical professionals. And we recently changed our title. So you'll see after my name it says EAM, E-A-M-P, instead of L-A-C. And the reason for that is because we practice a whole system of medicine. So in order to more accurately reflect that, the fact that we don't just do acupuncture, we've changed our name to East Asian Medicine Practitioner. When you go in and you see an acupuncturist, you might experience acupuncture, you might experience Chinese herbal medicine. We do massage, which is called Huina. We do cupping. We do a heat technique called moxibustion. So there's a lot of different techniques encompassed in this system of medicine. So how Chinese medicine is different is that it's more looking at the whole body. So I think a lot of good medical practitioners tend to do that, where you look at not just where the symptom is, but the entire body. But in Chinese medicine, you're memorizing patterns that are symptoms that are seen as connected. So the focus of the medicine, instead of A causing B, these two the relationships between them, it's more like how do A and B relate to each other, and what else is going on that could be impacting them. So one good example of this is with digestive issues and allergies. Western medicine has just started to kind of realize how much the immune system is in the digestive tract, and how when people are dealing with seasonal allergies, a lot of times they're having digestive issues, or maybe they're eating some foods that their body might be allergic to as well. So in Chinese medicine, the connection between digestion and nasal allergies is they're both the same. They're like on related meridians. You can't treat one without treating the other. And that has been going on for millennia. So this kind of holistic view of the body is more what you're getting with Chinese medicine. Let's see. So a lot of people ask me when you do acupuncture, are you stimulating the nerves? And I get people who have had those nerve conduction tests come in and they're like terrified, but they're in anyway because they're in serious pain. I do not stimulate the nerves. The goal is not to have that nervy, shocky feeling. The feeling when you get acupuncture should be a dull ache at the most. It should be relaxing. And it's more about rebalancing the body. So we look at the meridians, we look at where your pain is, and we use the acupuncture needles to open up qi flow, is what we say, qi and blood to the area to help resolve that pain. One thing that a lot of people don't know is there's several different styles of acupuncture. So I've been trained in what's called TCM, or traditional Chinese medicine. There's also Japanese style, there's Korean, there's 5-element. So there's a huge variety of techniques and different practitioners. My own personal style, I tend to have a more gentle, subtle technique. So I don't go for the heavy qi feeling is what we would say, the achy feeling. I don't go for heavy stimulation in most cases. So one thing about Chinese medicine is that we also have a lot of different diagnostic techniques. So we can look at where the pain is along the meridian, what's affected, but also back up and see what else in this person's life is contributing. Is it because they're sleeping poorly? Is it because they're having seasonal allergies and the environment's really wet and damp like it tends to be? Do we need to address those underlying imbalances in the body? Is it because they have stress, and is this pattern commonly associated with a stress pattern? As far as Western medicine go, a lot of people ask me, like, well, how does acupuncture work? I mean, there's been lots of studies that have shown that helps with low back pain and headaches, but as far as the mechanism of how it works, that is still, no one really knows. There's a couple theories. One is gate theory, which is that when you have chronic pain nerve impulses, they travel slowly through the nervous system, and acupuncture can kind of override those impulses, giving a more immediate chance for the body to reset, essentially. But that doesn't answer the whole question of how acupuncture can help with non-young pregnant women, or how it can help with. I had a person who's dealing with really red, dry eyes, and so her eyes are dry, painful. She's been to the MD. She has blocked tear ducts. It's one of those cases where after one treatment, I would expect to maybe see something, maybe not. Usually it takes a series of treatments. She reported after her first treatment, she had 3 days without having any dryness or pain. So, I mean, that kind of gives you an idea of the variety of conditions that acupuncture can help with. Since I always go over time, I'm going to try to stop early and see if anyone has questions. Are there any questions? Yes?
So you said she got, where did you stick the needles?
Oh, well, that's another. So a lot of people are like, oh, you're going to put them in my face? Please don't. You don't, because the meridians flow through the whole body. You can, if you imagine that, you can affect the other end. So to get to the eye, you can put needles around the foot, you can put needles around the hand. So you don't have to work locally, which is awesome. I love that.
When we are referring to when somebody goes, ugh, needles, is there something that you would suggest that we say, like, how do we help people move past that to getting them in your door?
Yeah. Well, you can say, most people find it a very relaxing experience. They're welcome. That's why I do free consultations, because for a lot of people, they're very anxious about coming in. This way they can come in, they can see my space, they can see that it's a relaxing, safe place for them to be. And I also tell them they're totally in charge. My husband's needle phobic, so I've worked with a lot of needle phobic people. We can do just a limited number of needles, just a couple, or even one or two.
And she passed all 4 tests, too. All right.